I want to talk to you now about the purpose of the education course and the things that book's going to give you, and some resources that you'll have and things that you need to know now that you've decided to have your surgery done. So the purpose of the education is to really just inform you of what's going to happen, how it's going to happen, what you should expect from us, and what we're going to expect from you coming into the hospital, and then what you should expect after your surgery as far as your rehab and expectancies for recovering. So we're going to cover a lot of different things as we go through here, but right now I want to just talk to you about the resources that you have. And when you come through, you're going to have access to case management. They're going to meet with you on a daily basis to make sure that we're getting you prepared going home, make sure you have the equipment that you need to be successful at home. I also make arrangements for you with the medical supply companies to be able to deliver that equipment to you at home, and you'll be able to contact the medical supply companies once you get home if you determine that you need something else. You'll already be set up, ready to go home, and you won't have to worry about those things from your standpoint. We'll take care of it for you while you're here. If you decide that you need to go to a rehab facility, we're going to reach out and we're going to make those arrangements for you. The rehab facilities, they'll send people over to talk to you about what they can offer you, and then you get to decide kind of where you want to go. Case management makes all those arrangements here for you while you're in the hospital, and we're going to make sure that you're prepared going home. We're going to look at safety and things like that and make sure that you're physically prepared to go home. So coming in, there's some things that you have to do for your pre-op and to be prepared to have your surgery. So you're going to come in, your physician is going to talk to you about the medical problems that you currently have. He's going to look at whether or not you need to go see your primary physician or your cardiologist or your pulmonologist for medical clearance before you have your surgery. So when you come in on pre-op, you're going to come in, you're going to visit with our main desk downstairs. You're going to check in with them. You'll come in, everything you'll be registered. You'll go through all the registration process. All that'll be taken care of. You'll bring a folder with you that the office gives you with all the orders that they want for you to have done while you're here for your pre-op testing. So part of your pre-op testing, you're going to come in. You're probably going to have a chest X-ray. Most likely you're going to have an EKG to make sure your heart's healthy. You're going to have lab work done, and then you're going to have some blood work drawn, and so you can be typed and crossed in case you have to have blood during your surgery or after your surgery. You'll meet with the pre-op nurse, and she's going to go through everything that you need to be aware of. You need to bring a up-to-date list of your medications or your medication bottles with you when you come for your pre-op appointment. And if you just decide to bring a list instead of the bottles, you'll need to know the name of your drugs, the dosage of the drug, when you take it, how often you take it, and when the last time you took it. We'll need that information to be able to accurately do your med reconciliation list. So after you've gone through all that process, then they will give you the date and time that you need to call back to make sure that you're still scheduled and what time you need to be here for your surgery morning.